My name is Sarah McGohey and I'm the clinical matron at the Countess Brecknock Hospice here in Andover, and I've had the absolute pleasure of being part of that team for next month will be 18 years. I know, I left from school. I often ask myself, and particularly at the moment, what's actually kept me there for so long? And in short, I know the answer. It's the service and it's the team. It's a team that really does focus on patients' quality. We offer care, attention to care, and really, really close attention to detail. No 2 days are ever the same, as my husband, who arrived late at the back, will probably tell you when I get home. But actually, I'm really proud. It's a service that responds and adapts to the needs of our patients every single day. Now, we care for anyone with a life-limiting illness who is aged 18 years or over, and we cover our local community, as Alex showed you the map of the whole Hampshire hospitals coverage. Our area covers 9 GP surgeries, both in the town and in the villages, so we have quite a rural community as well. And if anybody's from Andover, you'll know that it's a very interesting area, and that it's got areas of high affluence, but also there are some areas of poverty as well. And the town is, as you've already said, expanding at an absolutely enormous rate. We are seeing our new housing developments appear on the edges of the town, and every time I catch the train to London, I just see they're getting bigger and bigger. But our care and our services at the hospice care for absolutely everybody. I'd like to hand you over to Michelle now.
So I'm Michelle Gard. I'm the director of the charitable trust that supports the hospice. I joined back in September last year, but I've got nearly 20 years of fundraising experience and a background in finance and marketing. And my focus is to generate the income to support my clinical colleagues in the services that they can provide. I'm just going to give you a little bit of background to the hospice in case you're not aware of how we started. This is the first hospice building, and in October 1988 the Countess of Brecknock, she did exist, together with Lady Mary Fagan and Dr. Marjorie Williams, launched an appeal to build a 4-bedded hospice within the grounds of the Andover War Memorial Hospital and fund the unit for the first 5 years. And the first patients were admitted on the 17th of September 1990. Now, this is a building you might recognise just a little bit better. Then in 1998, an independent charity, the Countess of Brecknock Hospice Trust, was created to support the work of the hospice. And the new charitable trust raised sufficient funds to add an extra wing to the hospice building, creating 2 single bedrooms and a family room within the inpatient unit, as well as offices and treatment rooms on the ground floor. The hospice currently has 6 beds in the inpatient unit, but we provide a lot of other services that you might not necessarily know about. So Sarah's going to tell you about those now.
Thank you, Michelle. Anybody that knows me knows I love this flower diagram. So I think this is the easiest, most visual way to explain some of the services that we offer from the hospice. As Michelle said, the inpatient unit acts as the hub for all the services that we offer. And the inpatient unit itself, as you can see from that last slide, is located on the first floor of the building. So access to outside space is extremely limited. Until very recently we did have a small balcony, that's now been knocked down. And due to NHS requirements, you can only open windows about that much. I don't know if they think the patients or staff might throw themselves out, I'm not quite sure, but it's not very much at all. Patients are admitted to the inpatient unit either from their own homes or they may be transferred to us from hospital. And they come to us for end-of-life care or for management of their ongoing symptoms. The team at the hospice consists of nurses, doctors, including consultants and therapists. The hospice team admits and discharges 7 days a week, so this truly is a 7-day-a-week service, offering both end-of-life care and management of symptoms. Many people ask me, if you come into a hospice, do you leave? In fact, yes, of course you do. Over half the patients that we admit to the inpatient unit are discharged. And they may be to their own homes, sometimes it's to other people's homes, Occasionally it might be to a nursing home. We've actually discharged somebody to a shed in a field. Wherever that person wishes to be, their preferred place of care, that's where we'll discharge them to. The demand for our inpatient beds is extremely high. An example, we've had an MDT, Lara's at the back there today, we have an MDT today, and we have 2 patients being discharged tomorrow. We've already decided which 2 patients are coming into those beds, and the beds will only be empty just probably for a few hours. Such is the demand for our care and our services. And this is for several reasons. Really, it's a great place to be cared for. It's quieter, but actually we offer very high levels of nursing and medical care, and we have advanced clinical skills as well. And we do this to ensure that our patients receive the most appropriate and best care possible. That's our inpatient unit. Daycare, my next petrol. Daycare, we're very fortunate to have Susan Turner with us today, who used to be our daycare leader. Our current daycare runs 10 days, start again. The daycare is the first service that was offered from the Countess Brecknock Hospice and continues to be the most popular and one of our most demanded services. Daycare has capacity for 10 patients a day, 3 days a week. Now this service offers full holistic assessments and ongoing care. It successfully manages to combine both a medical and a social model. And I don't know if anybody's been to daycare, but it really is a very social model. Allowing patients to enjoy the company of others while at the same time receiving much needed support from our team of nurses, therapists, medical staff and complementary services. They can receive such things as massages and reflexology if they so need. Daycare also offers respite to carers, as it offers volunteer drivers that pick patients up from their own home and they bring them to the daycare, which is here, just along the corridor, and takes them home again. So patients, husbands, wives and carers are allowed that little bit of respite, an opportunity to catch up with friends, family, or even just nip to Tesco's and do the shopping. My next petrol. Hospice at home. Now what we do know is that many patients, when asked, would prefer to be cared for and die at home if possible. Now there are many services available that will allow this to happen, but many of the services are only available during the day. And if a patient requires assistance overnight, the default service is either 111 or a 999 emergency ambulance. And this is not a great solution for patients who wish to be cared for at home. And what we were noticing is that many of our patients were being admitted to an acute hospital unnecessarily overnight, simply because there was nobody else to contact overnight. Therefore, we thought, we can probably improve that a little bit. So we offer a hospice at home service, which is a nighttime service only. It's run from the inpatient unit. The team will know the patient and they will know the family. The families just have to pick up the phone and ring the inpatient unit. We are able to respond to assistance to calls immediately. So if a patient needs a visit, being a very local area, we can often be in the patient's home within half an hour of that call being received into the unit. And we offer both assistance on a one-to-one, or we can also offer telephone advice. And sometimes it's something really, really simple, such as, I've just given my husband some Oromorph, some medication, he's still got pain, can I give him a little bit more? And sometimes it's just that friendly ear and that little bit of support you needed. And sometimes we have to respond in person and give assistance in the house. But the beauty of this service is that we know the patient. Next petrol. Home care. This is our newest service, and this was actually started out of absolute necessity. We as a team were finding that we were becoming increasingly frustrated we couldn't get patients home. We already know that we discharge over half our patients home again. We all know that there's frustration, social care isn't available in the community, we couldn't get care packages, we have a very large rural area locally. In order, we could provide funding for our patients to get them home. So many of our patients are eligible for fast-track funding, so we could supply the funding and arrange that. But what we were having to do was wait for the care, and we were waiting 1 week, 2 weeks, 3 weeks, and in that time the patient's condition was deteriorating. This was an increasingly frustrating situation. And we were sitting down saying, we were already offering hospice at home, so we were saying, why don't we just offer it ourselves? And that's exactly what we did. We now have a team of carers offer personal care and support to patients in their own home. It's all fully funded by Fast Track. Our response to care is almost immediate, with care starting the same day or next day. And I can explain to you what the care does, but actually I'm really proud they received an WOW award yesterday. So can I just tell you, I won't read all of it, but this was received, they were nominated by Doctor. So time and time again we hear amazingly positive feedback from our patients and family about the home care team. They are there to help people to die at home by enabling them to either stay at home or to be discharged from hospital. The role is to help with personal care, but they do so much more. Their job is not easy. It's supporting people and their families at an emotionally and stressful time. They always feed back on how the patients are, and they always ask for help and advice appropriately. They all not only provide good quality hands-on care, but provide significant psychological support. They are sensitive, compassionate, calm and caring. They are the key to providing people with a peaceful death at home, and that will stay with the relatives forever. And that was a really nice award, so they're all very proud of that. Now on to our community palliative care team. Now this is quite a small team, but a crucial team. It consists of 2 nurses and a specialist doctor. This team sees patients either at outpatient clinics or in their preferred place of care, which is very often their own home, but it could quite easily be a nursing or residential home as well. The team focuses on assessment of complex needs, including symptom management, family dynamics, and psychological support to both patients and their families. They prioritise quality of life, advanced care planning, and often act as a liaison to other healthcare professionals. And they would easily see, they have a huge caseload, 60, 80 patients at any one time might be on their caseload within this community. Next question. Treatments and day procedures. Seems as if I'm making this up, but once again this started almost by accident. We were offering clinical support to a member of our own team who was actually having chemotherapy. And the idea developed, and due to the clinical skills of the team at the hospice, we are now able to offer a peripheral line care for patients that are currently undergoing chemotherapy treatments. We offer day procedures such as infusions or blood transfusions, and we also disconnect chemotherapy pumps, particularly at a weekend. And this all prevents patients and people having to travel to either Winchester or Basingstoke, but now word's got out, it's Southampton, Salisbury, absolutely everywhere. The advantage of this is, of course, that as a team we're open 24/7. We don't run a Pacific clinic, it's just offered from the staff on the unit. As soon as patients got onto that idea, they realised that they can access our care at a time that's convenient for them. And an example I often give is that we were looking after a gentleman who actually worked in London, who worked in the city. He was having chemotherapy, he was quite well, thank you, he was having a curative treatment. He would pop into us 7 o'clock on a Thursday morning, receive line care, and then be on that 7:35 to Waterloo. That is how adaptive our service is. He did cut it a bit short a few times, and I couldn't be held responsible for him not catching the train. Bereavement support, this is absolutely fundamental. It's an essential part of the care that we offer. Our bereavement group here meets in the hospice every single month. It's on a Thursday, isn't it? And I'm really happy here to have Susan Turner with us, who is one of our leading bereavement support workers. All families that we come into contact with that are bereaved, either in the inpatient unit or any one of our services that we touch, are offered the opportunity to come and have bereavement support. They are routinely offered 2 bereavement sessions, and following that, if anybody needs any extra bereavement or one-to-one follow-up, then that is offered to them as well. The team are all trained and supported by cruise bereavement. And also I think a little extra, which is really nice, and we get a lot of positive feedback, is we always remember the first anniversary of somebody's death and we send them a card, and then we often receive a card back saying, thank you very much, that was a nice touch. Nearly there, don't worry, you're not asleep yet. I mean, education. Education and learning forms an essential part of all the work that we do. So we offer support and learning to healthcare professionals as well as to carers and patients. So just today we were with a carer, a husband, showing him how to use a hoist at home. Next week we might be putting on a study day. 2 weeks time I've got a shadow shift, somebody from a nursing home coming to see how the unit works and how we work with syringe drivers. So our education is ongoing, it's often informal, but actually we also do run formal sessions on study days and events. So that really is a whistle-stop tour of the services that we offer. That doesn't answer my first question, what keeps me there and what makes it so special. So if I was talking about services, I could be talking about any service, but what makes the hospice special? I think we, or I certainly, take for granted the specialist skills of the entire team. But actually it's a really, truly caring team that cares for individuals. Very often our patients come to us and they've had a series of complicated medical investigations. They might have had scans, blood tests, x-rays, be part of a research programme, and they feel often defined by their condition. And research has shown us that as medical professionals, if we view patients as people, we help them make different decisions and the most appropriate decisions for them. So we have a board who's doing the budget. Malcolm, I'm really sorry, you know there's lots of cost with the new hospice, but one thing I'm absolutely passionate about, in all of our rooms we have these amazing notice boards. The glass, you can write on them, they're magnetic, but they serve a very good purpose. We ask all our inpatients, tell us 3 interesting non-medical facts about yourself. Because as we as healthcare professionals see the person as a person and not as a 57-year-old man with lung cancer, we suddenly start to see him as a 57-year-old dad of 3 that loves sailing and has a classic car, and he becomes a different person. And that's fundamentally what makes the hospice so special. This question though has caught a few people out from time to time. Bob shared with us on the board in his room, he loved his 2 Labradors, he liked playing golf, and he really supported Southampton football team, and that was great. We all wrote it up there, somebody put the Southampton emblem up. What he didn't mention, unfortunately, was his wife. It didn't go down very well, and we very quickly had to add a few extras to his list. Another thing we ask is, what matters most to you? Given that your time might be limited, what are the most important things to you? It's a question you need some courage to ask, because sometimes you can be surprised by the answers. Now, I've got some photographs of people, they've all given their permission, but I've changed the names. So as a result of this question, we learnt the most important thing to Rosemary was her dog, Lilybet. So we welcome dogs, animals of any description can come up to the hospice. Steve has held a little puppy up with us. Another important question we asked somebody, Pam, what's the most important thing to you? What's important? And she really wanted another weekend away with her husband and her family. So that's what we arranged. There's a hotel in Bournemouth, I don't know if anybody knows, called The Grange, and that offers accommodation for patients that might have high healthcare needs. So we arranged accommodation, we arranged oxygen, we arranged the transport, we arranged absolutely everything but the weather. But they had a great time anyway. And then you might have seen recently, Michael was last year actually, Michael, one of our inpatients, confessed that he never actually got round to marrying Linda, despite promising to do so for quite a few years. We love a good wedding, and this one actually made the papers. But actually, George will tell you, I went home yesterday, he said, what have you done today? I said, I've arranged a special licence. So we've got a marriage happening next week as well. And finally, I have to tell you about Helen. Now, Helen arrived at the hospice having spent many weeks in Southampton General. She was bedbound, incredibly weak, and her prognosis was very poor, expected to be in the region of less than a week. We asked that same question to Helen: what's the most important thing to you? And as I said earlier, if you ask the question, you've got to be prepared for the answer. The most important thing to Helen was her horse, Clyde. And so Clyde arrived at the hospice, thanks to Donna and her team as well. The whole hospital supported with this. Getting a big horse into a hospital is not easy. Very special moment for the family, and there was not a dry eye in the house. Even our porters were touched by that one. And although these are examples of the things that you can talk about and you'll remember, the really most important things to people are: can I have a large gin and tonic? Can my friends visit any time, day or night? And actually, can my wife stay with me tonight? And that's the really, really important things that keep me focused on the hospice and have kept me there for 18 years. This is a local hospice caring for the local community. It cares for me, my friends, my family, your friends and your family. I'm really sorry. I've got some lovely relatives with me at the moment. So can I just thank you very much for your time, and I'm just about to hand you over to Michelle.
The current hospice is a wonderful place and is rated outstanding by the Care Quality Commission. However, as Sarah says, demand for our services are increasing. Over 800 individuals and their families used our services last year. Our average stay last month was just 6.5 days, and we have a 97% occupancy rate. We now need facilities to meet the increasing demands of not just today, but for the future. And so, in April 2017, the Hospice Trust launched an appeal to raise 4.2 million to build an extension to the hospice. And the extension will provide us with 10 new single ensuite inpatient rooms on the ground floor with access to outside space with doors that open, which is really important, as Sarah said, for people's well-being. It will give us multi-use treatment rooms, improved and enlarged daycare, assisted bathrooms, new facilities for relatives. Relatives will be able to stay in the room with their loved one, rather than at the moment us finding beds and sofas and putting people up wherever we can. They will be able to stay with their relatives. It will also provide us with a quiet room, a new entrance and reception, and a lift leading down to the new wings. So we're really excited about the plans that were put together. We're even more excited because work started on the 21st of September last year. And this is us with our spades. As you can see, they're pretty shiny. I don't think we really got them dirty at all, to be honest. And volunteers and staff, and we've cut the first turf and the builders started working. This is the aerial view that was taken by a drone that the builders supplied us with, and this was taken about the middle of January, and you can really now quite clearly see the footprint of the building. So this is the current hospice. They've had to build an incredible retaining wall here, and this will be the lower ground floor. You can see the bedrooms beginning to come together here. This central section is where the mezzanine and the daycare facilities will come out through this part. This is the lift shaft, and the staircase will be here, and the entrance will be over there. I've got some plans over on the table if you want to see them in more detail. But it's all now beginning to come together. And this is the photograph that I took at the end of last week. So here's the lift shaft. They've now actually finished most of the walls on the lower ground floor where the bedrooms are. You can see this steel superstructure. They've now completed the ground floor where daycare will come across, and every day we look out, we can see more happening. So the build is a 57-week build, so they started in September, and we expect them to finish, with fingers crossed and a fair wind, at the end of October this year. So then we need to obviously get it equipped and commissioned, and so we hope that it will open maybe before Christmas or the new year of next year. Now 2020 will be the 30th anniversary of the opening of the first building, so it will seem really appropriate that we will officially open the new hospice in our 30th year, which will be really great. That's what it looks like at the moment. This is what it will look like when it's finished. This is sort of like on the side, you can see the courtyard areas where the rooms will come out to. And this is our artist impression of what our bedrooms will look like, and we've been putting together colour schemes, which we're very excited about over there on the boards with the architect. So single rooms with we've decided now, we've marked everything out, there'll only be one chair, but it's going to be a bed settee with a proper mattress so someone can sleep there. We're going to, the doors will open out, so the patient will be able to go out in the bed or chair so they can be outside. Ensuite bathrooms, and we're going with the sort of the green and creams to bring the outdoors in. That's the whole point of our colour scheme. So we're very, very excited about that. This is part of, you know where the steel superstructure is? Well, this is going to be holding up this mezzanine area, which will give us some more family areas and public areas for people to sit, for people to have meetings, to see staff, to hold clinics. We will have these areas, and that's the ground floor, and then in the lower ground floor we will be there will be tea and coffee points so that families will be able to use these areas. So if their relative is having a treatment or being looked after, they'll be able to come out here, they'll be able to have a coffee, they'll be able to have something to eat. So much more space and areas than we have at the moment. And also these areas provide us with a space for us to actually do some fundraising and events from the hospice, which we've never ever been able to do before. So we'll be able to invite people in without intruding on the patients, and for people to see what we do and make it more open. And that's an important part of getting that message out to people. You'll see here a tree, and we're going to have an eternal tree. And the eternal tree is 7 feet high, and it's in a lovely sort of metal colour, and it comes with bronze, silver and gold leaves. And we're going to use those to say thank you to people and remember people, and they will go on the tree, which will be there for people to see. So it'll be a beautiful piece of artwork, but it will also have a purpose as well. Because we have a policy that we don't have plaques on everything. We know that people love to give us things, but if you're lying in bed and you've not got a lot of time left, you don't really want to look around and see lots of plaques within memory of. So we're going to have a book with names in, but we're also going to have our tree, so that it's a much nicer way of saying thank you in memory of people. Then once we've completed the building, it's got to be equipped. So our trustees, and particularly Lady Mary Fagan, has been working tirelessly to raise the money that we need to build the building. And at our Light of the Life event in December, she announced that we've actually raised the 4.2 million that we need for the build and to cover the fees and the fundraising costs to do that. So we now have the money for the building, which I'm sure you'll be delighted to know. And we're now doing some fundraising to raise money for the equipment to help offset some of the equipment costs. And also to be able to provide items which are more homely. So we know it's an acute medical facility, but we want to also make it a home from home. So for example, we're trying to hide the medical gases and the hoists in cabinets, recessing the hoist rails. We want to have furniture that looks more homely, providing it meets our infection control requirements. And looking at artwork and all those sorts of things to actually show that it's, you know, when you come into the hospice, it doesn't look like it's an emergency room, but it looks a more home from home, but can provide all the medical facilities that someone needs. So this is just an example of some of the equipment. So we've put together a little catalogue, and I actually went to a donors' lunch today, and one of the ladies said, "Oh, this is just like the Argos catalogue." So I'm hoping she's going to pick out several things to fundraise for us. So the hospice is a really special place. I've been associated with it now for 18 months. I absolutely love my job. I come in every day and something different and new happens. I meet some amazing people, and it's thanks to the generosity of our local community that we've been able to support the hospice for nearly 30 years, to raise the money to build it originally, refurbish it, and now to actually invest in the new hospice for, as I said, today and the future. And it's really humbling for me to meet so many people that have had personal experience, but who actually want to make sure that the care that we can provide just carries on. So thank you for coming this evening, and I hope that was an interesting sort of update of where we are and what's happening with the building.